going to spend the next 15 minutes talking about pet supplementation and potentially food. We'll have that sort of chat about what's going on in both of those. This is Eric Anderson. Eric, can you introduce yourself? Who are you?
Sure, Eric Anderson. I am the founder and managing director of Next USA. We prepare clinically validated dietary ingredients for some of your most common, really, health issues that we face, whether it be joints or digestion, things of that nature. So, very happy to be here. Thank you.
And again, I will say that Eric, it was literally this morning that he said he would do this, so it's very kind of you.
So be kind.
Yes. Okay, so we will get started. Once again, if you have time to go to the mixer at 2:15, that would be great, but understand that if you don't. So you have to find him at his booth if you have more questions about pet supplements.
603.
Okay, so we'll get started. This is a softball. We want our pets to live forever. How much does food and supplementation, how big of a role do those have in that longevity?
Sure, everything. So, show of hands, think of someone, not yourself, not someone in the industry, think of someone that you know very closely. How much do you think they spend on dietary supplements a month? So, the ranges vary, but according to CRN, it's somewhere between $20 and $40 for a supplement user. All right, now think again, what do those people spend on their children? $10, right? Multivitamins.
Flintstone vitamins.
Maybe an omega-3 fatty acid. Now, what will they spend on their pets? So the national average for pet supplement parents is $30 to $40 a month. Consistently, folks will go to their veterinarian and they'll spend $1 a day without blinking. And now we see this becoming much more mainstream. And so what is the goal? The goal is optimal pet health so that, Fluffy can be healthy and happy for as long as you can, right? And now I've forgotten the question. Longevity, right?
The supplementation. So what role does food, really, supplementation, nutrition play in keeping your pet alive for as long as possible?
So the interesting thing about dietary supplements for animals is it follows a pretty consistent trend. It becomes very popular in humans, and then the pet owner says, wow, I think my dog needs this, right? Fluffy can't jump on the bed anymore. Maybe she needs a joint health supplement, and I've been using glucosamine and chondroitin, so there it is. And that was probably one of the first that jumped into the veterinary area was glucosamine and chondroitin from one of the companies in our industry, and they had a pet version and a human version. It was essentially the same stuff.
So yeah, I guess that sort of leads into what really does the science say? Can we take human supplement? Can I give my dog vitamin D? How does their body work differently? How does the science work?
So that's a tough question. I think one of the most interesting things is we see in mammals have very much the same mechanisms, and really the one that we're mostly concerned about is inflammation. But you can look at even hormonal balance, stress, cortisol can really lead to lots of issues with pet behavior, for example. What's very interesting, I think, about the pet supplement market are the veterinarians dose by weight of the animal. So a small animal gets a different dose than a larger animal. We don't do that with humans, largely, right? The other thing that's very interesting about pet supplements is they want that clinical study. Why should I dose X amount to a small dog versus Y amount to a larger dog? We want to see the clinical evidence. Unfortunately, many of the supplements out there are not clinically validated. There's really almost a higher criteria on the pet supplement front, especially if you're going into veterinarians. Prove that the science works, and then bring it out into the market. Now, in our particular case, we start screening at cellular levels. We move to in vitro, so in a test tube, to in vivo, typically in small mammals, rats, and you prove it works there. And then you move into your human studies, right? And so you're validating that it's working in a rep, and you think it's going to work in a human, but you have to prove it. So Dogs have a very similar mechanism for many of these supplements. A horse has a very different digestive system. A cow, a ruminant animal, has a very different digestive system. So this is why it's so important to validate the individual ingredient in that pet.
Interesting. So I don't know if you don't have to know the answer to this. This is just like, this isn't on our list, and this is me just being curious. Is there the same sort of tension between pharma for animals and supplements as there is in humans? Like, are vets just as likely to prescribe a supplement as an actual drug? And it's okay if you're like, I don't know.
I think there's a criteria for belief. The veterinarian, we're speaking specifically of supplements for vets, not mass market pet supplements, right? They want to see the data. They want to see the evidence. I would liken that to a healthcare practitioner. They tend to be early adopters, but don't come to them with, hey, I have an ingredient. Here's my study. Here's the population. Here's what we looked at. Then your practitioner will recommend that supplement. It's a belief based upon science, and the vets are very much the same.
Interesting. So you said that people are very willing to spend money on their pets and for supplements. How big is this market? Like, how much opportunity is there for some of these ingredient companies to like dip into the pet world?
The opportunity is enormous and growing, and we see brands going mainstream like Chewy, to name one. And I think the other side of that question is, how is that impacting pet food, right? So another show of hands. How many folks go to Europe or Asia and eat everything in sight and lose weight, right? When you go someplace other than America and you buy a piece of bread, right, the next day it becomes a rock, right? You can pound a nail with that piece of bread. Our bread somehow lasts in the bread drawer for months, right? We have a real issue with highly processed food in America, and it's hard to get away from it. You can't buy spaghetti sauce without high fructose corn syrup in it, right? But our flours are highly processed, and everything that's going into packaged foods is highly processed. And dog food is highly processed. And so we're putting all of these grains and inflammatory fatty acids and all these fillers in the dog food. And is anybody surprised that they're not terribly healthy, or they have dry, flaky skin, or they're just not feeling as vibrant as you would expect? Well, of course not. They're eating terrible food like the rest of America, right? So I think there's really a nice trend where we say feed the pet the most quality products that you can. And, looking specifically at things like inflammation. Are we getting a nice balance of omega-3s to omega-6s in the pet food? And is the pet food getting a good source of those omega-3s, right? Or is it completely oxidized and degraded? So I think if we treat the pet food similarly to what we would treat the human food, then you're going to have a more healthy pet.
I think you can answer this. And again, this is just curiosity. What would, let's say, an ingredient supplier have to do to be like, I think this works in pets? What's like the next step? Data?
So the first thing, we are working on a study right now for an anti-inflammatory in pets. And this works the same way in animals that it does in humans. So we start at the top of inflammation. And inflammation is longevity, right? Inflammation is something that is a real issue for all humans. So we start looking at, okay, top of the line, the balance from omega-3s to omega-6s, or maybe more familiarly, omega-3 fatty acids from fish oil. So EPA, eicosapentaenoic acid. If we have a lot of eicosapentaenoic acid, an anti-inflammatory omega-3, and not so much inflammatory omega-3s like arachidonic acid, then you get a nice balance. And so you're doing better. When that arachidonic acid cleaves from the cell membrane and starts to degrade, it goes down two pathways. And this is inflammation, right? The most common and recognized pathway is the COX-2 pathway. And so aspirin and ibuprofen and most of your NSAIDs, they're targeting that COX-2 breakdown. I give credit to the natural products industry for recognizing that there's another very important pathway, the 5-lipoxygenase pathway, 5-LOX. And actually the Boswellia people showed this first. And there's really wonderful Boswellia technologies on the floor, like 5-LOX and Aproflex. If you can slow the breakdown of arachidonic acid through the 5-LOX pathway, then you can also inhibit inflammation. 5-LOX, by the way, if you think of Singulair and Advair, these are 5-LOX inhibitors or leukotriene inhibitors. That's over here. But industry, natural products industry, so that it is actually systemic. So if we can take on both of those pathways and prove that it works, then we can show that you can reduce significantly inflammation. You can measure that in the animal's performance. There are tests that you can do looking at walking, looking at stairs, animals and humans. Another test you can do is a weight-bearing response, where you put weights on the animal and see how they respond to that weight. So you can measure, is it working? Are we reducing inflammation? You can certainly look at blood markers like TNF-alpha, highly sensitive C-reactive protein. And so biomarkers are great. Biomarkers don't lie. They move or they don't. They're completely objective. And so we take all of this knowledge from the human studies that we're conducting in our particular product called Tamiflex, and then we say, okay, what do we give the animal, right? And once we determine what the dose should be, best guess, and then you have to actually go out and do that study, and that's a double-blind, placebo-controlled trial. Even though the dog doesn't know that the researcher knows what you're giving to them, you still blind it so nobody knows until you break the code and you say, yes, there's a difference between placebo and active. We studied horses, and this was tough. How much do you give a horse? Our human dose was 250 milligrams, and so you say a human, well, an American is maybe 80 to 120 kilos, a little high. So we said, how much does that horse weigh, and how is the digestive system going to? We settled on 3 grams. And then we enrolled the horses based upon their lameness scale, which was set by the American Veterinary Society. They have the measure of lameness. Now, that is a lame horse, or in this case, pony as well. And then before and after, exactly the same as a human study. Is there a difference from baseline until after the study? So fortunately, the horse study came back very, very positive. That product was actually just launched with Platinum Performance. And now we're going to try to prove it in dogs. So it's a whole process. It's even a little harder in animals than humans because it's harder to get through the ethics panel. And the way that animal supplements and feeds are regulated in the United States is more on a state level. So you have to make sure that you're okay to put it in the food in the first place or in the supplement. But it's the same process.
Fascinating. Let's see. We have time for one more question. What are some maybe emerging science or ingredients that you see like on the horizon that if a brand is interested in like making a pet supplement, what is the thing they need to have in it?
So we first saw glucosamine-chondroitin in the different joint health products. Of course, omega-3s have been well recognized and is a very large, commonly consumed supplement. I think as we also look at human nutrition, digestion can be a big issue. And in our research, we're very specifically interested in the impact of cortisol, right? So when we're looking at our research, we're saying, think of a child, right? I'm upset, my tummy hurts, right? It's the same thing in adults. We're upset, all the stresses of life affects our digestive system and impacts how you feel, how you deal, how you sleep, how you're feeling to take on your day. It manifests itself in bloating, gas, constipation, and anxiety, right? So I think as we look at some of the pets that are spending a lot of time at home and they're feeling the stress of the parents, worrying about things like home, I don't know, tariffs. How does that impact the animal? We have a new rescue dog, and we're giving them stress powder, not capsules, right? So animals have capsule fatigue as well. So it's easier to sprinkle powder on the food than it is to put peanut butter on the capsule. Although it's more fun to lick your fingers after that.
Okay, well, that is all the time we have. Thank you so much.
Thank you.
I told you it would go by rapid fire.
Okay, yeah.
And once again, friends, if you haven't already, do this. Give us some feedback. I would love it. And then let's give Eric here a big hand.
Thank you.
Thank you so much.
Thank you. Thanks, Kathy. Okay.